Hello, my name is Crystal Reyes. This PowerPoint will discuss adolescent marijuana use, a behavioral health intervention. Marijuana is the most widely used illicit drug among high school students. The prevalence of marijuana use continues to rise as the social acceptability, perception of use among peers, sensation seeking, and the desire to self-medicate continue to rise. Perceived great risk of regular cannabis use has declined significantly over a 10-year period. According to data from 2017, approximately 5.9% of high school seniors have used marijuana daily for the last 30 days, and 23.9% of 8th through 12th grade adolescents reported using marijuana within the last year. Despite ongoing prevention efforts, the prevalence of marijuana use continues to rise. With the trend of smoking cigarettes decreasing, studies indicate that adolescents viewed marijuana as more socially acceptable than cigarettes. Studies indicate that although not all adolescents use marijuana, there are no specific determinants of health that indicate who will use and who will not. Moreover, this paper examines the determinants of health for the population and the subgroup of the population. The population of adolescent marijuana users includes the determinants of health that affect the population are deviant behavior, boredom, low perception of risk, low perception of harm, access and availability, and social norms. The subgroup of all adolescents are the at-risk youth. Those factors include high crime and high violent neighborhood, broken homes, teenage pregnancy, parental use, and socioeconomic status. There are multiple risk and protective factors that are indicators of adolescent marijuana use. Some of the risk factors are parental use, emotional distress, accessibility, social norms, peer use, deviant behavior, high levels of stress with low coping skills, low perception of harm or risk, low engagement in school, and cultural identification. There are a group of adolescents that don't use marijuana, and some of those protective factors are parental involvement, social and academic skills and performance, parental influence and closeness, parental monitoring, parental resources, perception of parents' disapproval, regular wellness checks, involvement in school-based activities, and increased communication with parental figures. So why does adolescent marijuana use matter? Marijuana users displayed poor school performance, spent less time on homework, and had more school absenteeism than non-users. Substances have a greater negative impact on the adolescent brain than it does on the adult brain, which increases the risk of further use, adversely influencing the development of the regions of the brain associated with judgment, attention, memory, and reward seeking. The earlier an individual initiates substance use, the greater the likelihood for developing a substance use disorder. Adolescent marijuana users have a higher risk of involvement with the criminal justice system than non-users. Behavioral health theories are theories and models that support the practice of health promotion and disease prevention. They aid in understanding, explaining, identifying, developing, and implementing intervention strategies. The common constructs. There are common constructs that the behavioral health models have that in relation to adolescent marijuana use. There have been numerous studies using multiple behavior theories that examine adolescent marijuana use. With so many variables, it's challenging to form a distinct picture of adolescent use. There are multiple constructs that predict, describe, and explain marijuana use in adolescents. Of the behavior theories studied, 4 theories best explain adolescent marijuana use and provide a foundation for future interventions. Behavioral health theories. Social cognitive theory, theory of planned behavior, theory of reasoned action, and the health belief model. Social cognitive theory was developed by Bandura, and it evolved from a social learning theory. It focuses on the relationship between the person, their environment, and their behavior. It emphasizes on social influence and reciprocal determinism. Self-efficacy is the foundation for this behavior change. It's an interpersonal level of behavior change. The theory of reasoned action and the theory of planned behavior. They examine the relationships between one's behavior and beliefs and one's attitudes and intentions. Behavior intentions is the foundation. It's an intrapersonal behavior theory, and the difference between the two is the perceived control. The health belief model. The health belief model is one of the most widely recognized theories. The model that attempts to explain and predict health behavior. Its health motivation is the foundation. Perception of harm, perception of severity, and self-efficacy are constructs, and it is an intrapersonal health belief model. There are 3 examples and types of interventions. Interventions that target the individual, interventions for school-based interventions, and community-based interventions. You're not what you use when you use marijuana. Be yourself and don't use is an intervention targeted for individuals. It focuses on self-efficacy, subjective norms, perceived severity, and focuses on factors influencing behavior. School-based intervention, such as curriculum-based support group program, is an intervention that is done in the schools, and it supports self-efficacy, social norms, expectations, and environmental influences and peer influence. An example of a community-based intervention is the Most Teens Don't Use, which is a social norming campaign. It focuses on the attitudes, cues to action, reinforcement, social norms, and beliefs about marijuana use. Based on the research, social media campaigns that focus on reframing the normative beliefs surrounding marijuana use in adolescents. It would include a parental education component, adolescent education component, peer group role, pre and post testing, and follow-up. In conclusion, as self-efficacy in adolescence rises, the prevalence of marijuana and other substances use decreases. Prevention efforts should take into account adolescents' perception of risk, benefits, social norms, and peer influences when implementing strategies to reduce adolescent marijuana use. Social acceptability and perception of risk and benefits are important predicators of social health behavior decision-making. Early adolescent access to substances and offers of substances within the home, sibling, peer, etc., are considered additional risk factors for early adolescent substance use behaviors. Studies indicate that perception of parental disapproval of substances increase adolescent anti-substance use norms. And tailor-made interventions that consider the population included in subgroups were found to improve risk behaviors. I utilized 10 references. Thank you for listening.